Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Hello, my name is Dr. Derek Barron, and welcome to another amazing episode of the Prime Health Podcast. We interview doctors, nurses, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. We explore breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So before we get into today's episode, a quick note from our sponsor, Growth Solutions, your growth partner for busy health and wellness professionals. Growth Solutions works to eliminate your biggest headaches such as new patient lead flow, lack of patient communication, AI and tech overwhelm, video production, and ways to streamline the business operations. We don't work as a vendor, we partner with you to generate a consistent flow of qualified patients, simplify platforms for better communication with patients. We create engaging campaigns to attract your ideal patients and referral partners. And we also implement frameworks and automations that allows you to get away from the practice and have fun away from it. So if you ever heard or said this yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we'd love to help. So if that's you, just drop the word grow in below, or you can reach out to me on LinkedIn as well. But I want to dive into our guest today. She is the star of our podcast. Dr. Emily Cordes is a board certified physician in both internal medicine and pediatrics, serving as the lead physician at Root Functional Medicine, with a strong foundation in traditional medicine and a passion for root cause healing. And I can't wait to hear really what that means. Dr. Cordes specializes in helping patients navigate complex chronic health concerns through a functional medicine lens. So Dr. Cordes, welcome to the Prime Health Podcast.
Thanks for inviting me.
Absolutely. So everybody kind of gets this as an intro, tell me the story about it, but was there something specific that happened in your life, a moment, an issue, something that caused you to choose medicine as your
medicine, not originally. I think it was a lot of compounding variables led me into medicine. I think that, I guess my more thought-provoking discussion would be what brought me into functional medicine, specifically, because I'm trained I'm a DO, but I'm trained traditionally. I did an ACGME residency in both internal medicine and pediatrics. So 6 years it crammed into 4, where you're basically just doing a lot of inpatient bedside care, which was a great experience. I really did enjoy a lot of residency. And originally I was all about, maybe I would even do critical care as a career, definitely on the opposite end of what I'm doing now. But at some point, I think probably in my second or third year, I remember actually being in the critical care unit, really sick people. And, some of them were there for unfortunate events that had happened. But when I looked around the unit, a lot of the things that led even younger folks into a pretty dire situation was chronic disease. That if someone had talked to them maybe 10, 20, 30, even 40 years earlier, that their outcome and their prolonged suffering wouldn't be there. So I really had to reevaluate, gosh, do I want to just work on this end of life picture and hopefully reverse it in ICU, right? But, we're all human and we know what's happening. But I really just it didn't sit well with me, and I knew we needed to approach things differently. So I completely reversed things and said, okay, well, primary care is the model that should really meet people before a lot of chronic disease sets in. So I shifted focus and I was like, well, I'm going to be a primary care doc. And I graduated residency and started working in primary care, and it was not what I thought it was going to be. That whole idea of meeting people where they're at before disease sets in and doing a lot of counseling and prevention just really isn't. The skill set is there for physicians, but we aren't allowed the time, and it's the time, and it's also not really reimbursable. So you could spend 45 minutes or an hour with somebody preventing the heart attack that's going to happen 25 years from now. But you got to keep the doors open and the roof over your head, right? And anyway, so it's prevention is really not reimbursed well in the U.S. healthcare system. So I started looking at like what other avenues in medicine can I pursue that really do, I still wanted to work with people. I didn't want to go the policy route. I still really love meeting with people. But I needed a different structure and a different way of even thinking about chronic disease. So I looked into a few different, there's fellowships in preventative medicine, there's the American College of Lifestyle Medicine, and I found that functional medicine, it honestly takes a different approach. It looks as somebody more in the like osteopathic way that I started my roots with of like, gosh, we all have these organs that are connected and that we are like mind, body, and soul, and not just like a kidney and a bone. It really resonated with me that there are root causes of chronic disease, and that we can think a lot of these different diseases that we code and bill for, right? And we can think of it in a like, well, what's actually causing that upstream, So, and from there, after I trained in functional medicine, serendipitously, there was a practice starting and where I already practiced primary care, and I joined Root Functional Medicine, gosh, like 5 years ago now, and it's just been growth ever since. So, yeah.
So as a classically trained osteopath, did you do manipulation as part of your practice?
Yeah, originally. Well, maybe not part of my practice. I'm trained in it. Let's put it that way. And even my my residency was we had an ACGME residency, but then there was an osteopathic track adjacent to us, so I could like hop into all their lectures and stuff, which was great. But when I got out in practice, it just wasn't that takes just as much time as actually talking to somebody about like, let's change your nutrition plan, let's get you exercising, et cetera. So it wasn't something that was available to actually use as a tool.
Yeah. Well, I can tell you are way ahead of where the country is going from choices right now, where people are thinking more about functional medicine, which is great. I mean, you're a leader in that, and I think your patients probably are tremendously thankful for that position. So once you came in with Root Functional Medicine, can you tell us the unique approach that not only you, but I guess your company takes into medicine?
Yeah. So we can talk through the like how we approach patients and individuals differently, and then we can also talk through sort of like how we approach healthcare delivery differently.
Okay.
Which one would you like to hear? I guess is my.
I'd like to hear both. I love first and foremost patients. Let's talk about how you guys, if I come to your practice, however I may get there, how do we approach me as a patient?
Yep. Yeah. So, well, first let's set the bar with what would happen if you had a symptom and you went to a primary care doc, right? You would call in and likely get a 15-minute appointment, and that 15-minute slot also includes the time that they're going to write their note and bill for it. And maybe 30 if you're really lucky, that'd be great. But what that really, it takes the doc's time and condenses it down to maybe 7 to 8 minutes in the room with you. And maybe I'm not that smart, but I just couldn't put a whole puzzle together in 7 minutes of somebody that maybe has developed chronic disease over 30 years. But honestly, I don't think any human can really do that. And I don't think 7 minutes allows that counseling time. So that's sort of where the bar is at. At Root, we have extended patient appointment time. So for the first visit and subsequent visits with both a physician, well, we'll start with the physician piece, is 45 minutes. And that original visit is like, we're going to talk about like, what are symptoms looking like right now? But we're also going to dive into like, I need to hear the whole story. Like, when did this start? Let's talk about like what happened in your childhood. I want to hear every med you've been on and every surgery you've had. And it's just like, I want to hear people tell me their whole story about their health.
Okay.
So it's just an extended time period. And then the unique part of this is that I know I can't do my job as a physician without good nutrition counseling. And I'm not a dietitian. So for me to be giving nutrition advice is a little bit out of my scope of practice. Now I can do the basics, right?
Sure.
But to sit with somebody and really say, like, let's go look in your refrigerator together and see what's actually happening here, that's out of my scope. So the model at Root is that everybody sees both a physician and a registered dietitian. I think that the model, honestly, it works, right? RDs alone will complain that they don't know all of the medical jargon, right? And like they can't prescribe, and some of the testing is unavailable to them. And I think physicians should be complaining that they don't have the education to give nutrition support. So it's the perfect match there. So you just have a lot more support than to come into a primary care doc with your one symptom and be sort of like, here's your prescription and you're out the door. So then when it comes to like, what do we actually, like, how do we reverse disease, right?
Mhm.
There's there's the habit perspective. What does your day-to-day look like? We do use key supplements. We do prescribe medications when appropriate. But most of the medications that we prescribe are not your fancy blockbuster meds. We know some of the older ones really do, they're safe and they work. And maybe they're not fancy and expensive and flashy, but we know they work.
Sure.
So we still use some meds, but I think it's probably the last data I pulled was like 5% of our total prescribing, maybe even like 4 would be a medication, whereas the majority of it is really like, how do we address symptoms with a change in nutrition, lifestyle, and then some key supplements. So
Mhm. It's amazing because unfortunately, and I do think the tide is changing, but unfortunately people think because of what they're educated upon by watching television that they need to have a medication. That's the only option. I have family members that believe that. There are many options that are out there. We didn't have medications like we do today 30 years ago, 40 years ago, 50 years ago, and people were, as we can see, much healthier. So it's a great approach that you're taking, just like your DO roots, allowing your body to allow itself to heal from the top down, inside and out. But you're giving that as a team approach. So you said you've got physicians and you've got dietitians. So in a sense, who makes up the team at Root?
yeah, that's the team. You're really, as a patient with Root, you're really only going to meet the doc and the RD. We work virtually in all of 48 states. We don't have licenses in Alaska or Hawaii, mainly because we can't order labs there. There's no Great Quest lab locations.
Interesting.
So we're almost nationwide, but you'll potentially meet one of our customer or our members experience coordinators who might help you like log on to your virtual visit. But otherwise, there's really no other clinical folks that you're going to meet. I personally love that we sort of cut out a lot of like the middlemen as far as like, in primary care, you tell your story to one person that comes in the room and then they relay it to the next person. It's just
Correct.
like, how many times am I going to tell my story, right?
Yeah, the old red Solo cup with a string attached to it. Does it?
Yeah.
Does it follow through from first person to second person?
Yeah. Whereas at Root, right, you're only really going to be working with your doc and your RD. And we collaborate quite frequently. So every member we touch base on. So it's not like it's siloed where you're seeing the doc and then you may see the RD the next day or the next week with what works in your schedule, and that they don't talk. Like, no, we collaborate because we know that that's where that secret sauce is on getting somebody long-term feeling better. So
Okay. From a condition perspective, what comes in? What do it's not probably just one, but are there, 5, 3, what are the main conditions that come into your practice?
yeah, so our niche, we're still sort of what you would consider a general functional medicine practice. But I would say that metabolic health is number one. maybe not number one, but it's probably my favorite to work with.
Okay.
So maybe that's why I call it number one. But some of the other docs like other things. Metabolic health, anything endocrine related, so hormonal, both male, female, thyroid, etc. Um, any of autoimmune disorders, that's a big one, and that maybe that's my number two of as far as like fun to work with autoimmune.
Okay.
Chronic gut conditions. So both the autoimmune gut conditions, Crohn's, ulcerative colitis, etc., but also this catch-all of what primary care and a gastroenterologist is calling IBS. And
Mhm.
maybe that's what the title people have been given, but we know that 70% of IBS diagnoses are more along the line of a dysbiosis SIBO picture,
Mhm.
SIFO, well, depending on what's growing, where it's at. So a dysbiotic picture, a lot of gut issues, skin conditions, mental health would be another piece here. So anxiety, depression, ADHD, etc. So
Okay.
yeah,
So a patient is, as they're watching this or learning about you online, however they are finding out about you, they come in with a condition, and let's just say it's type 2 diabetes. Okay. So if they come in, can you give us an idea of how it truly is different in your practice? I know you've gone through it, but what are the 3 steps they would do as a general practitioner, and how does that differentiate in your practice?
yeah. If you come into a primary care doc and you have, let's say, type 2 diabetes, you're going to be given hopefully to start, a prescription of metformin, which would be a safe and inexpensive medication. But if you watch TV, there's all these fancy new diabetes meds out there. So those are your options, right? Sort of this is the diagnosis, you've got type 2 diabetes, and this is the pill you're going to take for it. Pill for the ill mentality, and that's frankly where medicine has been at since penicillin was invented.
Mhm.
We look at things differently. So what I want to figure out is if you're 65 with diabetes, when and why did you get there?
Hmm.
So what lifestyle factors probably in your 20s, 30s, and 40s got you there? What does your lifestyle look like right now? How do we get you back into a lifestyle that actually supports metabolic health? So that's sort of the like general, like how I think of things, but the nitty gritty is like I do talk about everything from like 5 a.m. when people get up to like hopefully 9 p.m. if they're sleeping 8 hours. What does it look like, right? What are your little day to day pieces? We order some advanced blood work to figure out what is driving diabetes, but also then what are some compounding variables that could be present with that diagnosis. And then we look at, is there insulin resistance driving this? Likely. What piece does stress play a role as? And then it really depends on what I think their biggest factor is on their next step. I can't neglect nutrition if it's a metabolic disease. So obviously we're working intimately with a registered dietitian on that. We work through a patented what's called root plate. And it is a macro system of sort of how I call it like eyeball a plate, right? I don't think that it's a healthy mental space to be in to weigh your grams of food every night for your dinner for 40 years. But we should be able to look at the plate of dinner that we've prepared for ourselves and say, this is a plate that will help me reverse diabetes. And that's what our registered dietitians help people figure out.
This isn't a difficult question by any means, but the patient that goes in to see the primary care physician outside of your practice is basically going in there, and typically they may be given a medication and say, okay, come back and tell us how it is later. And most people right now are following that path. When they come into your practice, they have to make a big lifestyle change. How do you guys help them?
Yeah.
How does your practice help them adjust to this? Isn't just a pill on top or under your tongue. It's when you wake up at 5 and before you go to bed, there's a commitment in between those days. How do you work on that with patients?
I think physicians want to think that we prescribe the medication, we'll say metformin, and that people go pick it up and then they take it every day and their diabetes gets better. So that's what we're trying to do, right? Like,
Sure.
why wouldn't somebody do this? But I think the last statistic I saw was that only 40% of primary care visits do people actually go pick up the medication.
Oh my gosh.
So if you've got 60% of your diabetics that are not even picking it up, and then you've got to assume that not everyone's real compliant every morning,
Right.
right? So I think if we think through like, oh yeah, taking a pill is quote easy and lifestyle changes is quote hard. I actually don't think it's that black and white. I think that even in primary care, I would ask like, okay, what is the barrier here of not picking up your med? And that skill is also exactly what I do with my members that maybe have type 2 diabetes. Like, what is the hang up on getting, let's even say like 3,000 steps in today, right? Like, what's the reason for it? And we do, that's why our visits are 45 minutes, right?
Yeah.
Because I'm trying to figure out like, okay, why aren't we doing this, right? Like, and honestly, like some people, everyone's got really great examples of why. And I'm like, okay, well, then we got to figure out how we can, work around that. Most folks who are pursuing functional medicine have found that the meds themselves are not the free lunch that they thought they would be, that they come with side effects. They come with costs. And they come with maybe that things just aren't getting better, even though we've maxed out medications. So a lot of people actually do come quite motivated to change. Yeah, they really do. I think by the time they seek out functional medicine, they're like, okay, this isn't working. I need a different approach.
Yeah.
But I have worked with lots of folks who maybe want the approach on paper, and then they get into the day-to-day of like changing lifestyle, and it is hard. And I think we can all attest to that when we've tried to change a habit. But that's where we start to pick apart, like, what are our barriers to change, and just recognize that we're all human and none of us are going to do any of these changes at 100% every single day. So.
Yeah. Well, it's interesting because it seems as though the primary care physicians are going to follow up, but it seems like you offer something completely different within your practice, and you have an online community program about that. Can you explain how that can help with patient outcomes?
Root is membership based. So how someone enters Root, to start with, I guess what I should preface with, you start by just joining Root, and you can pay a low fee per month, or you could pay for the full year.
Okay.
That gives you access to both our Root community page, where people can support each other through their healing journey. And we do seasonal or monthly meal plans that are Root plate. So you can just you get a new meal plan of what you're going to cook for that month, which I personally love. But and there's a lot of community support in that way. So that's our community page. But the real perk of our Root membership is that you can actually start your healing journey on your own before meeting with a physician or registered dietitian. You can order direct-to-consumer Quest labs through us. You can also order advanced functional medicine testing as well, such as microbiome testing, Dutch testing, salivary cortisol testing, et cetera. We've got a few others on there. And our docs get your lab results back, and we do some personalized insights on them. Not just all labs look good luck, right? Which we're all familiar with.
Some are green, some are yellow, some are red, and that's it,
Yeah. No, sometimes I'm like, gosh, these interpretations are really long, but I love giving people as much information as possible. So you get a lot of pieces of information to start with before you even meet a physician. And some people are like, that's great, I didn't need a doc, and they get their answers. But we also people can actually work with us if they don't want to do just lab work. And that's when they start to, they sign up for an appointment with a doc and an RD. And we start to really dig into what's going on.
Okay. All right. Yeah. From a science and innovation perspective within your practice, what really is getting you excited about the future of healthcare, and especially within functional medicine?
Yeah. Delivery systems of functional medicine is really where I would say I'm most passionate about. I think that If you looked at functional medicine, gosh, even 2, 3 years ago, it was really siloed around our country, right? You would have practitioners get trained in functional medicine. They would hang up their shingle, and they would see patients, and that's fine. Like, I think that that's a wonderful addition to your community, but it's a rare community that has somebody that can do this. Functional medicine is also 2 years ago wasn't talking to each other well. So, the guy out in, let's say California isn't talking to the guy in Kentucky. Like, there's
Okay.
not a whole lot of collaboration, and there's no real like system to get people feeling better. Root looked at this differently and said, okay, first, then why can't all of our docs just have licenses in every state? We already work virtually. Why would we limit ourselves to state lines? So that's where we pursued nationwide licensing, so we can help anybody who has internet in our country. But then I think the next hurdle was like, that's great, but insurance doesn't cover this. And our healthcare system in the United States is so heavily based on an insurance model, right? But does it have to be? Was the question, right? We had a lot of members who were using their insurance for conventional care and then would pay out of pocket to see us. And, we decided to sort of take out the middleman. So instead of your employer contracting straight to your insurer and then your insurer covering your healthcare costs, we decided to talk to the businesses that actually needed our help. And say, okay, like, if you want your employees healthy, why wouldn't they just become Root members and see Root physicians and RDs? Basically, a B2B model. We're able to deliver care to a wide variety of people at a business, all the way from, entry level positions, all the way up to a C-suite of a company. And we're able to transform lives at all socioeconomic statuses and nationwide, instead of, functional medicine can seem like it is out of pocket for some consumers, and it can be expensive. So by saying, hey, like, these are the disparities in healthcare currently, let's see what we can fix. I think there are probably still disparities that we haven't figured out. But that was sort of our approach. Like, how do we deliver healthcare, functional healthcare, to the world?
So you started with patients, and then you have a branch, or I guess it's still within, the company, that you are reaching out to the businesses saying,
Yeah.
you've got 5 employees, you've got 55, or you've got 500,
Or
we
if I,
approach, yeah. Oh, really?
yeah,
Wow. Okay. So we approach this differently.
yeah.
What do you think this would do for productivity of your employees, health of your employees, longevity of your employees? It's a completely different approach. I've not heard of it. I think that's fantastic.
We had a few pilot companies a couple of years ago, and we were just like in awe of the outcomes, and how, both from a individual health, but also a decreasing a health spend for the company.
Mm-hmm.
And they were numbers that I had never encountered in primary care. The
Wow.
idea of, like, reversing some of these diseases in the course of 6 or 12 months, whereas usually in traditional settings, I was just chasing numbers to make sure things weren't getting worse.
Yeah.
That was my goal. And I'm like, wait, we reversed this? What? That's wild. So yeah, that's probably what I'm most excited about.
So as an entrepreneur in business, especially in private practice like you are, so what growth opportunities do you see in functional medicine? I guess you just said it, like, it's going after businesses, but do you feel that there's more patients searching for functional medicine providers than before?
I think functional medicine is still in its infancy. I think that, not that I can predict the future, but I would anticipate that functional medicine would be covered by some sort of insurance model. If that's 20, 30 years down the line, I don't know. There is the demand for it. What used to be seen as like alternative healthcare is really quite more like mainstream now. I think that there's obviously a plethora of podcasts, and if you just hop online, right, there's all kinds of, I would say like businesses that are working in the functional space, but don't offer the full end-to-end patient care experience, right? So you've got people just doing labs. And that's great. It gets people a lot of information on themselves, but like information isn't healing. And you've got a lot of great healing folks out there that can't get the information
Right.
that they need. And I think when we tie it all together and say, okay, but your employer is also going to pick up the cost of this, that's where the magic can happen.
Yeah, it's an employer's going to look at it as a cost basis, but I think the biggest basis is not having a health basis behind your employees.
Yes.
And I think the patients, as you said, they're searching for it, they're seeking for it more and more. They want the options, they're willing to do it. There's somebody with the same diagnosis is only willing to take the pill. There's another one that's willing to consider taking the pill, but what are my other options that are going to help, keep me,
Right.
an elongated lifespan, be around my husband, my wife, my grandchildren, be able to work longer, all of those kinds of situations. So in your practice as an entrepreneur, again, what are the biggest challenges that your business, your practice faces in scaling the practice?
Yeah. I mean, I think any scaling company is going to have struggles, right? I think I would say this, I mean, you could say this outside of functional medicine. I think people are really important. I think who you hire to work in all regards is probably the most important function of your business. So, is that a struggle? I don't know if I'd call it that. I think it's a challenge to find the right fit, um, to scale appropriately. I work with phenomenal people. I really think that like most of this model is not me. I think we've worked as a team, and our CEO Erica Armstrong is really leading a team of folks who are passionate about healthcare delivery and how we can change healthcare. So, if anybody's looking at like trying to scale something, you've got to have a good idea, but you really have to have a good team behind the idea.
Yeah. Yeah, it's good to be led by somebody that has a vision. And I'm sure you all kind of come together and take that vision and grow it. It's, root functional medicine. What's the power in the tree? It's the roots that's really the power of it. So I think that's a very good perspective.
Yeah.
So how do patients find out about you? How do they learn where you are? How do you attract patients in?
Yeah. So we're on social media. You can find us at Root Functional Medicine, Facebook,
Okay.
Instagram, whatever. But if you're interested in membership, you can just hop on our webpage, rootfunctionalmedicine.com. If you're an individual that wants to join our membership, it's pretty clear there. And then we also, if you work in human resources or are involved with management, we do have an employers page where you can get more information about partnering with us for more like a B2B side. And if you have questions, you can email us at hello@rootfunctionalmedicine.com.
Okay, love it. What if somebody is like you are not in private practice, but in a hospital setting? They're like, I'm getting burnt out. What advice would you give that doctor about taking that potential leap of implementing private practice, or especially implementing functional medicine into their practice?
Yeah. I like to think about, I think a lot of doctors wear golden handcuffs. I think you look at your lifestyle and you say, if I need to go get trained on something, it's going to take a few months. Do I need to cut back my lifestyle for a couple months? You get trained on a skill that gets me out of the job that is crushing my soul.
Yeah.
And I think that's what holds people back. And that's what I've seen out of a lot of docs is they can't seem to get out of the hamster wheel of like change, that they're not ready for change. But if you're miserable, like take the leap. It's okay so say you've got 3-ish months of decreased income, you're going to make it up and you're going to be happy.
Okay.
And you can't put a price on that.
Where do you see Roots Functional Medicine in the next 5 years?
Yeah. Our B2B growth is really as I mentioned previously, where we see the most growth. I never, I don't think we'll ever be closing down individual members. So everyone's always welcome to join Root as a member, but our B2B growth and the scalability of that is we can reach more people. So we would love to, that every employee has this benefit.
Yeah, that's cool. Can you share a success story that really stands out in what you've done, whether it was yesterday or in the past 5 years? Like, what's a success story of somebody coming in, probably failing in the typical medical model, but having success with Roots?
Yeah. I can, I've got a lot of cases that come to mind. But I will talk about one that has actually like been on the Root Functional Medicine Get to the Root podcast. So the story's already been out there, and I don't, so I think we're comfortable with speaking about it. But it was a young lady who had graduated from college, and things were great. And I think maybe a year or two post college, she had gained a significant amount of weight. She was a college athlete, gained a lot of weight, and she would go to her primary care doctor, and the doc was just like, well, you're not a college athlete anymore. Sort of the like, it's your lifestyle, like this is a problem, right? And I think she was getting really frustrated with that response when she knew that something wasn't right. And I sat down with her, and like, honestly, it was like 40 minutes in where I was like, yeah, this isn't right. And it did take me 40 minutes to just be like, are we sure it's not the lifestyle? And 40 minutes in, I was like, I'm actually not convinced this is right. So we did some advanced testing, both some blood work and then also a salivary cortisol test. And the results were pretty abnormal. And it led her down the pathway to an endocrinologist and a neurosurgeon due to a brain tumor on her pituitary.
Oh, wow.
Yeah, and it was removed. I'm obviously a virtual functional medicine doctor, not the person who removed it. But she, after removal of that tumor, she went back to her old self like very quickly. And she got her life back. And I think of that case of like, the statistics on sort of these quote rare diseases actually aren't that rare, but we need time to sit with people and actually pick them up. And that's what Root can do. So yeah, that's one of my favorite cases.
In 7 minutes, you have to be a magician as well as a physician to figure that out. There's just no way. And as you said yourself, you were kind of like leaning into, this is it. Maybe it is in her head, or it's just the function of age getting away from college. So that's a great story. Thanks for sharing that. I think this leads into basically saying it, but as a differentiator, you guys are a unique practice. What do you feel that you do better at Root Functional Medicine than any other company that's out there?
That's a good question. I really think the answer is that we connect disparate pieces of the healthcare system. Not only from our unique model of seeing an RD and a doc collaborating together with every visit. So individually, that's what sets us apart for the individual. But what sets us apart in the marketplace is that we are that connection between all of this like great data, right? You've got lots of companies out there that are offering lab data. But what do you actually do with that data to actually make people well? And how do you decrease Americans' crazy healthcare spend that goes up 14% every year, right? That's where our magic is at from a systems perspective, is that we can connect that.
Yeah. Well, it's been a pleasure. I'll make sure in the show notes we have all of your information, links, phone numbers, emails where people will be able to reach out to you, because I think it's true that this practice gets to the root cause. Like you said, it's important. If that girl had not been into your practice and she just followed the regular medical model route, where would she be today? would she be here? Maybe would she fall into a horrible depression? Where if someone took the time like you did, Dr. Cordes, to find that and help her, I think it's a big differentiator that you've done. So I commend you for that. So I just want to say thank you for taking the time to share your insights with us. It's a very unique perspective of where you were in the medical model, like most are, and realized it was a machine, and you didn't want to be part of the machine. You're one of those cogs that caused the machine to slow down a little bit. Maybe your employers didn't like that, but I think for the betterment, it was good. So it really helps the audience understand the full spectrum of healthcare possibilities. It just doesn't have to go down one route. There are branches to the tree that you guys have. So for our listeners, if you found today's conversation valuable, please subscribe to the Prime Health Podcast and on any of the favorite platforms that are there, or subscribe to us on YouTube as well. And if you found this valuable, please share it. It's not for us, it's for the patient that needs it. So whether you were out having coffee or playing pickleball and somebody just doesn't feel as though they're getting the healthcare results that they want, Roots Family Practices really functional medicine is really doing the right thing for the patient and for best results, because they're changing lives through cutting edge treatments by taking the time to listen. So until next time, remember that true wellness is a journey, and we're all on this together. Whether you're taking charge of your own health or guiding others through theirs, every step forward matters. So take care of yourselves, and I will see you next time.